Hi, I'm Dr Rod Jenner. I'm a veterinarian who's been involved in the commercial poultry industry my entire career. Today we're going to have a talk to Dr Alex Mastakov to talk about poultry in a more clinical setting. So it'll be very interesting to listen to Alex and what he has to educate us with. Morning, Alex.
Morning. Thank you, Rod. So my name's Alex. I am the director of the Unusual Pet Vets Sunshine Coast Clinic. I am a registered specialist in avian medicine and surgery, and I essentially see a very high caseload of avian and exotic patients, but particularly in the subgroup of backyard poultry that are becoming, increasingly, brought in for a variety of ailments and conditions.
Okay, so Alex, what sort of cases of backyard poultry do you see through your clinic?
So it can be quite variable. We do see a high incidence, particularly of respiratory disease, reproductive diseases, dermatological conditions, particularly foot lesions and foot conditions as well, and traumatic cases. So when birds are being attacked by other animals, wild animals, or other household pets like dogs and cats. And then we're seeing more increasingly geriatric cases as well, where we're seeing degenerative diseases and neoplastic diseases as well.
So do you see both companion type cases as well as perhaps a smaller commercial flock type cases?
So a larger proportion of cases do come from a companion side, so from companion flocks, where people are keeping these chickens in the backyard for a bit of egg production. They're not always eating animals, but they are at least eating their eggs, and they are keeping these animals as pets. We do see a larger population of also show poultry, where we have breeders that are breeding poultry, a few hundred birds, and then to a smaller extent, small scale producers as well. So these are rarer, but they usually have 300 to 500 sort of birds, and they're typically producing meat and eggs for the local market.
I guess the first thing we need to do is define poultry in a clinical setting. We all know what poultry are in a commercial setting, but what's your definition of poultry in a clinical setting?
So with backyard poultry, generally we find they belong to two large family waters. So usually either the galliforms, which are going to be our chickens, our quails, our turkeys, even to a proportion of peafowl as well. And then usually our anseriforms, which are going to be our ducks and geese as well. And they'll be the most common sort of poultry that I would see in a clinical setting.
Okay. And why is it important to understand the definition of poultry in a clinical setting?
It's very important to understand the definition of poultry because we often refer to poultry as food-producing species. So these species are, even though they're kept as backyard pets, or certainly sometimes as for eggs or for companionship, they still are technically classified under as food-producing animals. And I think that's a really important distinction to make when we talk about poultry.
So we're essentially looking at two different thought processes here. We've got the companion birds, probably living very close to the family in the house.
Yes.
And then we've got the commercial setting. Do you have a different approach to these two types of consultation?
I definitely do. So in a commercial setting, we have essentially a producer that's running a flock to generate income, of course, for animals. So it's the flock, the health of the flock that's important. And also we find these products that are being produced by these small scale producers, they're going out to multiple families or a larger portion of communities. So certainly the way that I approach and how I treat cases is very important in that situation, because my decisions can have wider reaching implications than when I'm dealing with an individual or small scale, couple of backyard sort of poultry birds, which are more pets and in those situations, the products produced by the species are, if they're consumed at all, because sometimes they're not consumed, they're most often consumed by the immediate family or at best neighbors.
So in terms of both the companion and commercial birds, what sort of things do you have in your pharmacy that you would expect a clinic to stock or to carry for those particular types of cases?
So we have a variety of medicines. So certainly we have antimicrobials that are allowed or suitable for use in food-producing species such as poultry, antiparasitics that are suitable and safe for food-producing species as well. We do also stock quite a variety of pain relief medications as well, and medications that probably wouldn't be would be rarely used in a commercial setting, and more on an individual bird basis.
Why is it important to be very selective in the antimicrobial choices that you make when treating both companion birds and commercial birds?
So regardless of whether it's a backyard flock and people are consuming only a small amount of eggs, or in a commercial setting, the possibility of drugs that are ingested, or antimicrobials in particular, that are ingested reaching the eggs and then being ingested by humans can be quite substantial. And so we know there are far-reaching implications potentially for this, from potential anaphylactic reactions to antimicrobial resistance issues. So when we are exposing native flora of the human to antimicrobials that might be required to treat an infection later on, and if that bacteria has become resistant, and we have a serious antimicrobial resistance issue, then we might actually have real serious problems with treating these resistant future infections as well. Yeah.
But surely someone with a couple of backyard chooks with a problem that can be treated with an antimicrobial, that's not so much of a problem, is it?
You'd think it wouldn't be, but it can be, because people often share eggs. It's not uncommon for some of my clients to have 6 chickens, and they'll produce 5 eggs a day. Oftentimes people find that they can't eat all the eggs, so they'll give it to their neighbor. They might take it over to their grandparents. They might give it to other kids as well. Occasionally they might even sell a couple of them on a very, very, very small limited scale. So while it seems insignificant, the potential for real issues is still there.
So what other advice do you need to give owners of backyard chickens that are being treated with antimicrobials?
So generally, if a client has multiple chickens, and in a lot of situations, and backyard flocks run together, then while the animal is on antimicrobial medications, I recommend having them located in a separate location and pen where access is prevented from the other animals. That's to prevent consumption or exposure of the other chickens to any egg products that they choose to consume it, any fecal material that might be accidentally stepped on or ingested through preening as well. So generally a place of isolation and monitoring. And then of course the client should be disposing of any eggs appropriately in their suitable sort of waste bins each time that the chicken might produce an egg.
So Alex, how do you decide which antimicrobials you can use or you should use when you have a clinical case?
Yeah. So regardless of whether it is a small commercial flock or it's a small backyard flock, it's still important to have a rigorous diagnostic process, because we want to know what we are treating. There's no point simply throwing in or doing a therapeutic trial, as in a lot of situations we may choose a suboptimal treatment or a treatment that may not work. So typically I will approach most of these cases like we would with anything. We're starting off with a good history, good physical examination, diagnostics, and that might include things like culture, swabs, necropsies in a select amount of birds as well, and certainly in some cases some more advanced diagnostics such as endoscopy, radiography, and blood testing as well. Once we've actually done those diagnostics and we have an idea of what we're dealing with, then we can start thinking about which antimicrobial we're going to use. So we thankfully have quite a number of good resources available to us, including the traffic light system and also the bacterial quadrants that tell us which antibiotics are going to be most suitable for a particular bacteria that we're dealing with, and then allow us to also select an antimicrobial that is not prohibited in the food producing or the poultry species that we are treating at the same time. I will often recommend actually laminating the actual traffic light system and putting it up near your pharmacy so that you can easily refer to it when you are prescribing antibiotics. And so the quadrant system is really simple to have in a nice little laminated booklet where you can flip through and have a look to see what you're treating as well.
So what in-house diagnostics or laboratory equipment or materials do you think a clinic would require for occasional poultry patients?
Yeah. So you'd have very similar in-house diagnostics in a lot of ways to what you might have for other animals such as dogs and cats, but generally in my practice we have access to virology swabs, bacteriology swabs, cytological evaluations, fecal analysis evaluations, specific gram stains and fecal stains or cytological stains, blood analysis as well. We do send blood externally as well, but in-house blood analysis, your biochemistry, and then we do a standard hematology or complete blood counts. And then, of course, we have access to radiology, endoscopy, ultrasonography, and typically those sorts of things.
So the antimicrobials you have on your shelf have labels on them, giving you specific instructions. Things like not being able to use them in birds that are laying eggs or may in future lay eggs for human consumption. Are these label directions just guidelines or are they rules?
So these label directions are definitely rules. They are there for a reason. They've been created specifically to avoid some serious issues and to help protect the public and certainly prevent issues from arising. When we we should be following those rules very strictly and to the letter at all times. If we have, for some reason, a specific reason to go against the rule, it should always be based on scientific merits with evidence behind it, as going against the rules can be deemed as professional misconduct by the veterinary service board.
Earlier, when we were talking about label directions, you did mention that there may be times when you have to go off-label. Under what situations would you go off-label, and what is the regulations around off-label use?
Yeah. So off-label use is essentially the use of a medication in either species where it hasn't been used before, at a dose that is not recommended, or frequency, essentially outside of what has been described for that species. Oftentimes in a clinical setting, we're dealing with patients that aren't, or backyard patients that will never reach the food chain, or their products will never reach sort of the food chain. And they can come with conditions sometimes where we don't have alternatives, or we don't have medications that have been labeled for use for specific conditions simply because that animal hasn't been, wouldn't be normally alive for as long before it was slaughtered for meat, for example, or where it's not normally in an environmental setting where it might be exposed to these, for example, like a dog or a cat attack or anything like that. So, or if it, for example, has a condition such as a neoplastic condition where obviously none of the chemotherapeutic agents for that would be considered on label by any means. So it is often a difficult situation, but in a lot of these cases we have to, if there isn't something completely available, there's absolutely no resources, we can look to the characteristics of the drug to give us a bit of a better idea of what sort of residues it's going to have. But in most cases that animal is permanently removed from the food chain, meaning nothing that it produces can ever be consumed by another animal or by a human.
And what about withholding periods? It's a very important issue as well. And labels will contain information on withholding periods.
Yes.
What does that mean, and what's the implications of that?
Yeah. So the withholding period, generally we have poultry two main withholding periods. We have sort of withholding period for eggs and for meat. And the withholding periods tell us how soon we can either eat the meat or the eggs from that animal after completion of the antimicrobial or medication course. And I provide this for all my clients as well on the actual prescription label, on the actual medication label, how soon afterwards they can consume the products from their animal in order for it to be free of antimicrobial residues.
Is it okay to feed those eggs to your dog in the interim?
So no, it's not, because there's many ways that antimicrobial residue can reach the environment, which then can ultimately be reconsumed by these food-producing species. It's very difficult to control where a dog will eliminate its wastes, of course, and what environments can contaminate with those antimicrobials. And that's not even considering the fact that when we have rain, when other weather events that could wash down that antimicrobial residue into waterways and other areas as well. It often seems like such a very minor and significant thing, but really we should be practicing really good standards and not feeding any of these products that might have residues to other domestic species.
So in the instance where you do have to use a medication off-label for the welfare of the animal, how do you go about deciding what withholding period to advise the clients?
That's a very good question. So if the drug has characteristics that we know that predispose to having very long residues, such as if it's got a very lipophilic nature, and there's no way for us to know without scientific rigor or a scientific study, then typically I consider permanent withholding period. It's just simply, you can't consume eggs or meat from that animal permanently. There are occasions where you have some preliminary literature where it's within a similar sort of class of drug, where it may be feasible to do half-life calculations, where typically a drug is eliminated after 5 to 7 half-lives. And in that situation, you might be able to make an educated decision. But if I'm very, very frank, if there is no scientific study for that drug, in almost all situations, I steer on the side of caution and safety, both for the client and for the community. I will recommend a permanent withholding period for off-label medications.
You did mention earlier that you also use other medications in your avian patients, things like anti-inflammatories, pain relief, anesthetics. Do they also have withholding periods?
So other medications such as anti-inflammatories, our pain relief sort of agents that we use, they do also have withholding periods, but it often is a little bit harder to find them. There is independent literature and scientific articles that are available for veterinarians to look up and to identify that withholding period, and oftentimes this requires time to look it up and write it down so you're aware of it from that point on, unless that guideline obviously gets incorporated into the prescribing guidelines, in which case we'd have to sort of follow that specific guideline as well. But generally you'd have to look to the external scientific literature for it to find those withholding periods.
So lastly, for the clinician who only occasionally sees poultry in their practice, what sort of resources or what's available online that people can go to get some ready information?
So fortunately, we do have a few resources available to clinicians. You of course have the AMR Collective website. We have the AVA website with their prescribing guidelines. There is the Veterinary Information Network that will have resources there as well. Certainly in the occasional setting you can also contact an avian and exotic clinic that would see a high proportion of cases as well. And certainly Unusual Pet Vets does have inquiries set up, or a system where veterinarians can submit queries to be answered as well. And you can never forget the importance of journal databases as well, where there's a wealth of articles. Avian Medicine and Surgery journal is quite good. It'll have quite a variety of research. And then there's also the Association of American Poultry and Avian Veterinarians as well, which has quite a variety of textbooks and resources that are available to any veterinary clinician, really.
Well, thanks, Alex. That's been really, really informative and an excellent discussion that we've had. Thank you very much for your time. Really appreciate it.
Wonderful. It's been a pleasure, Rod.